And actually, I use, if you would think of anybody into pastry and baking, if you have one of those pastry applicators, I can't think of the name of it. We simply have almost like a pastry applicator or a funnel. We place the implant in the funnel. We put the funnel through the incision, and then we squeeze the implant into place. And that makes it easier to get the implant where it needs to go. It doesn't allow a bunch of people to touch it, which can theoretically put bacteria or other things on the implant that we don't want. So again, can use a crease incision, a little bit generous. We use a funnel or cake pastry maker or applicator, and we put the implant in. So again, fantastic implant, works well with the right client. It works very well. So got another question. Robin's back on. Let's see. Question: would you treat a patient going through the transition with any of these implants? So I'm going to assume the transition, and we're talking about menopause. And for you ladies who are going through menopause, I'm going to take a slight break and say, I'm sorry. I'm really sorry. That it's tough, and I feel for you. And for the men going through menopause with their significant others, wives, I'm sorry too, but hang in there. It's it is really, really tough for them. So be supportive. So having said that, the question was, would I recommend any of either of these implants in the transition?